Do you tend to avoid going to the doctor because you feel bullied or ignored? If that's the case, you might be experiencing what is known as medical gaslighting. My name is Dr. Felicia, and I'm a psychologist. And in this video, I'm going to be talking to you about what medical gaslighting can look like and why we can fall victim to it. This is going to be a two-part video. I'm going to be talking about those topics in this first video. And then in the second video, part two, I will be talking about how to combat medical gaslighting and how to protect yourself from it. So, what is medical gaslighting? Well, if you're familiar with my videos on gaslighting, you will know that gaslighting is an erosive process and it occurs when the gaslighter, the person who is doing the gaslighting, is working very hard to make sure that you, the person on the receiving end of gaslighting, doubts your reality. It's basically a tactic used by abusive people, not only abusive people, but it's used frequently by abusive people, especially people with narcissistic tendencies, to make people doubt their reality. And doing this is a way of control. And so this also happens in the medical field, unfortunately. And I've heard just lots of stories about people who have gone to the doctor and have felt like they were the ones who were either crazy or difficult or just imagining their symptoms. Basically, they felt like what they were experiencing in their bodies was not real. And for individuals who watch this channel, a lot of you have been through some sort of abuse. And so I'm sure you're very familiar with that doubting feeling that you have, where you feel like, I can't trust my body, I can't trust my experiences, I can't trust my gut. And this happens, unfortunately, with medical gaslighting. So I'll give you some examples and see if you can relate to this. Have you ever been to a doctor and when you were explaining the symptoms, they didn't seem to really listen or care, and they dismissed a lot of what you said? So they might say things like, oh, well, that's just stress. Or, that really feels to me like that's really all in your head. These things really don't happen to people. Maybe you're just stressed out. Maybe you need to get more sleep. Or they just might act like whatever problems that you are talking about can't happen. And so this is really important for you to realize, because basically when you are treated that way, when you're dismissed, when you feel like you're being sort of bullied into silence, it means that the individual who is treating you is not listening to what you're saying. Now, I want to be very clear that you have to have nuance. And I've said this before, listening to this channel, you have to be able to understand things in nuanced terms, because not everything that I talk about is in absolutes. There are absolutely going to be times when you go to the doctor and you are explaining something, and it might be, the doctor might say, well, I have questions about this, or is this what's happening? And there may be a what's the word I'm looking for? I guess maybe a disconnect between what you're experiencing and what the doctor is describing or saying is going on. And that's fine. That's where discourse happens, and that's where a conversation happens. But when you are feeling like it's a one-way thing, you're not being listened to, you're being shut down, then that can be a form of medical gaslighting, especially when you're made to feel like the symptoms that you are experiencing aren't legitimate or don't exist. And so things being told, well, it's just all in your head, it's just psychological, it's just stress, it's just nerves or whatever. Um, though that might be true, but a proper follow-up to that is to maybe refer you to a mental health professional to make sure, okay, that these things that are, all in your head are being treated, right? And I don't even really like the phrase all in your head, because it makes it seem like if a problem it has a psychological connection, then somehow it's like not as legit, or it's the person's fault. And the fact is, our minds and our bodies are intertwined. That's a given fact. And so one thing affects the other. And you can't just separate the two into complete and distinct entities. My point in saying all of this is that while it may be true that psychological or mental health factors can affect physical health, when you go and see a doctor, they will make sure, if they're not gaslighting you, that they are taking those things into consideration and giving you ways to address those things and follow up with those things. So individuals who have been through medical gaslighting might, will definitely feel dismissed. They might feel like their what's the word I'm looking for? Their symptoms or their concerns are just being explained away. Oh, they might say things like, "Oh, you just had a baby," or "Oh, you're getting older," or "Oh, this is stress." And if you watch my videos before, I talk about with spiritual abuse, there's something known as a spiritual bypass, where there's this kind of um very large, vague explanation, spiritual explanation that is given to something that is more complex and more nuanced. And when somebody's going through medical gaslighting, the same thing can apply, where broad, non-distinct explanations are given to things that are much more specific and nuanced. Yes, we all experience stress. Yes, bodies change with childbirth and with age, but that doesn't mean that whatever problem that you're bringing up is not important and not worth looking into. So dismissal, feeling trivialized. Also, another thing that can happen with medical gaslighting is a strong reaction from the doctor, a strong negative reaction when they feel like their authority is being questioned or challenged. Unfortunately, this isn't just for medical professionals, it can be for any type of professional, but um, in the medical field, it can, certain things can occur with medical professionals, and some of them unfortunately have this idea that their their expertise is not to be challenged, right? And their word is the be all and end all. And so, I've talked to individuals who have come into a medical office with their own research, with their own questions, and they're being labeled as difficult patients, or they are there's kind of like this very strong angry reaction from the medical professional, kind of like, how dare you question what I'm saying, whatever thing you find on the internet is not true. And let me be very clear again, there is information on the internet that is not true, right? And so we have to be careful. Sometimes people come in with information that's not true or that is not applicable to that situation. However, it is up to the medical professional to handle that in a professional and non-condescending way. And people have experienced times where they've been labeled as difficult or even kicked out because they're like, well, here is stuff I read, here are questions I have, how can you address this, right? And so that can be really difficult. And, I'm sure you've seen stories about this, maybe on the news or wherever, about people who have been through medical gaslighting. And there are really serious consequences to that, because if someone is dealing with a legitimate problem and they keep getting brushed off and put aside, they're going to be less likely to go to the doctor. And there are people that, because of really bad medical experiences, you know, are they don't want to go to the doctor. I mean, even there was a story, I think, with Serena Williams, and she was experiencing some really horrible problems after she had given birth. She ended up having a blood clot in her lungs, but she had to really fight to get listened to and heard, because they just kept dismissing what she was talking about. And so it can be very difficult. And especially, there's situations and there are factors that can make medical gaslighting more likely. And so I want to address why it is, why we can fall prey to medical gaslighting, because there's a lot of shame around. So some people, after they've experienced this, might feel, oh, I did something wrong. How come I didn't speak up? How come I didn't see this? But we have to understand there are psychological factors that make medical gaslighting, and something that can happen, without us even realizing it. So if you think about, how we view doctors, doctors have a lot of power, right? They have a lot of training, knowledge, and expertise. And so they tend to be revered, right? And I've talked about this in some of my other videos about something known as the halo effect, where we see one positive attribute about somebody, and so we assume all these other positive qualities about them. And so, for instance, knowing that a doctor is highly educated, we can make other assumptions about the physician that may or may not be true based on that one thing. And so when we go into a doctor's office, we believe, that the doctor's here to help. They know more than we do, especially about whatever thing that we're, trying to get help for, all these other things. And so that can put us in the position of being less likely to speak up and critique and challenge things. There's also a power differential, right? And so in that room, the doctor is the authority. They do have power in that sense because they can prescribe something, not prescribe something, order procedure, and things like that. And so it can be really challenging for somebody to go in that situation and feel like they're heard and feel like they're not being dismissed. I've heard people tell me before that they've said that they didn't agree with something the doctor said, and they've basically been told, well, look, I'm the expert here, and you better listen to what I say, or who are you to question me? And that also happens with people who gaslight other people too, instead of addressing the issue. So for instance, my video I talked about with gaslighting, or a lot of the videos, I explained that people who gaslight other people do this as a form of deflection. And so instead of being able to acknowledge their own shortcomings, their own difficulties, they will try to deflect attention to what the other person is doing, criticize them, or say, well, you're not right, you can't perceive reality correctly, and get them to doubt themselves. And that can be the same with doctors who gaslight people. For them, they might not know what is going on, or they might feel that the problem is out of their wheelhouse. And in those situations, the appropriate thing to do is say, you know what, I don't know what is going on. I'm going to refer you to someone, or I'm going to do some research and get back to you. Here's what I think we can do in the meantime. But acknowledging their own shortcomings too, and say, you know what, I don't know everything. Here's what I think is going on, or here is somebody who can better handle this. And so when somebody's in that position where their ego is threatened and they don't want to admit wrongdoing, or that they don't know something, that gaslighting can come on pretty strong. And so I hope that from this video you've understood what some of the signals and signs are of gaslighting and medical gaslighting. And stay tuned for part 2, in which I talk about what you can do to combat that. If you have any questions or comments, I'd love for you to put them in the comment section. And for those of you who have dealt with medical gaslighting, what was that experience like for you? I'd love to hear from you. To book your free consultation, go to my website, skillsetcounseling.com. Click on the orange button to book your free consultation. All right, I hope you have a wonderful day that's filled with peace. Bye-bye.